Good afternoon. So my practicum experience has been with the director of a cardiovascular service in a Western North Carolina hospital in a small community. In this hospital, I learned is managed by UNC Health Systems. They not partnership, but they're managed, so they can utilize the programs and computer programs that the UNC Health has. However, they get a percentage of it, and that is how it works. They can utilize some of the resources of the bigger hospital, and they just get a percentage of it. So my preceptor has 30 years of healthcare experience, and 20 years of those have been in leadership, and it has been awesome to observe her and watch her in her role. I actually met her when I was a CNA 20 something years ago, and she was an RN on a cardiovascular floor, and so that was my initial experience with her. And to see her now, it's just so amazing because she is super like relationship centered. It has the ability like to be transparent, and she accomplishes outcomes and goals, and she empowers her staff to do the same, and she has mutual respect. Like she treats the environmental services just like she treats the CNO. She communicates and she's professional. I've seen her upset. However, she told me that she never just says what she's thinking immediately. She always asks people if she can get back with them so she can have time to think about the correct response. I see her advocating not only for her staff, but for the facility and for the patients. I have watched so many staff members be upset about their pay, and I have watched her move mountains to fix it. I have watched her be so passionate. One STEMI came in, and no, it was not a STEMI, it was a pacemaker, and it was someone who's had multiple infections. They needed a sleeve for this pacemaker, and they did not have one, and they started looking for one, and she had the cardiologist postpone the procedure until the next day so they could get the appropriate sleeve for the patient to ensure to limit his chances of getting another infection. But the biggest thing with being in this rotation is she led the development of a 24/7 STEMI program at this hospital, and I got the opportunity to be there for their yearly anniversary. And you have to seek for reaccreditation from the chest ACC, and their numbers far exceeded what they had to have for the accreditation. So that's been nice, and I have had the opportunity to do chart audits because we're looking at the STEMIs and the time that it takes from out in the field until they're in the cath lab. And I've got to work on that data, and because they're trying to further this program, which is needed, and I've got the opportunity to sit in interviews and discuss the candidates of cardiologists, both invasive and non-invasive, and that's been kind of exciting as well. I got to go with the stroke coordinator, and we educated the community at a corporation in the community on Heart Healthy, and I've been sitting in meetings on developing a stroke protocol. So and also auditing charts to see all the chest pain, ED admits, and what is required as a low chest pain versus high chest pain, and creating an algorithm to make that whole process smoother for the staff and the patients. This rotation has been trying time working and school like we're all experiencing, but I have learned so much that I know that I will take with me in the future, and how to communicate and deal with high stress situations, and that's been awesome. And I look forward to hearing what the rest of you guys have to say about your experience as well. And I hope you're having a good day.